When you study cognitive learning, you are studying the process of the brain takes to learn. You are trying to figure out how the brain perceives its environment, develops problem-solving skills, and stores memories. This process can happen with subconsciously and consciously, and gaining insight into them will hopefully help us to improve our learning on the conscious side of things. With that in mind, let's talk about the use of BCI-based cognitive learning. I'm Thiruvan Jayakrovan and welcome to the topic of Internet of Thoughts, Chapter 10. For instance, some people learn better by watching, others by listening, others by writing, and others by doing. Knowing this and identifying which person are which, we have to be aware when these approaches takes into account and more efficiently transmit knowledge to the people. Cognitive learning theory covers two specific theories, social cognitive theory and cognitive behavioral theory. CST focuses on behavioral, environment, and personal factors, while CBT focuses on the individual's perception of three things: the self, the environment, and the future. Obviously, SCT will help the teacher to create an environment that is conducive to learning, while CBT is more the realm of the consular who helps the client reformulate ideas about themselves and their situation so they can function well regardless of their environment. Social cognitive theory started as the social learning theory in the 1960s by Albert Bandura. It developed into the SCT in 1986 and posits that learning occurs in a social context with a dynamic and reciprocal interaction of the person, environment, and behavior. Social cognitive theorists propose that people set goals for themselves and direct their behavior accordingly. They are motivated to accomplish those goals. Cognitive behavioral therapy is a short-term, goal-oriented psychotherapy treatment that takes a hands-on, practical approach to problem solving. Its goal is to change patterns of thinking or behavior that are behind people's difficulties and so change the way they feel. An interesting finding arises from the present review concerns the limited number of studies addressing the use of BCI for cognitive assessments of patients with physical limitations, despite the clinical and ethical relevance of longitudinal neuropsychological evaluation in neurological disorders, especially in neurodegenerative conditions. At present, a widely used BCI paradigm is the visual P300 BCI. Even if it requires patients to perform ocular movements and fixation to some extent, several studies demonstrated that it can be employed also with ALS patients in the late stage of the disease where oculomotor abilities are often altered. However, several studies have proposed gaze-independent P300 or SSPEP based BCIs for patients with DOC who often lose the ability to fixate their gaze in order to overcome such clinical and methodological issues. Recently, encephalography-based BCI systems have been employed in order to improve cognitive functions in patients with ADHD. Munoz and colleagues designed and presented a BCI-based video game for training sustained attention in ADHD patients to be implemented by means of low-cost BCI systems. However, such systems has not been validated in a clinical population. So, the Lin and colleagues also developed a series of training games where users' attention levels measured by encephalography signals can be used to perform exercise. Such approach proved to be useful to enhance attention abilities in children with ADHD by improving parent-rated inattentive scores on the ADHD rating scale. To conclude, some emerging challenges arise from the present review and represent possible relevant targets of future investigation within the field of BCI use for clinical purposes. In particular, the possibility of bringing BCI-based training into patients' home by developing low-cost and portable systems in order to provide more intensive, effective, and long-term treatments of cognitive functions. In relation to the previous point, the improvement of usability and customizability of BCIs to users' characteristics and cognitive capacities. The investigation about outcome of the BCI-based cognitive interventions with respect to brain functions, changes, and reorganization. The improvement in the realization of BCI-based neuropsychological tests to be validated in clinical populations against gold standard measures. So I hope you all learned about the cognitive learning and how it can be used in brain-computer interfaces. So that's a wrap up for the chapter 10. I'll see you around.